Hi, I'm Scott Needham. I'm a cardiothoracic surgeon. I'm a physician. I live in Billings, Montana. And I want to talk to you for a few minutes today about the use of marijuana. Some people ask, does it really have significant medical side effects and medical problems? And I'm here to tell you that it does. The National Institute of Health and its sister organization, the National Institute of Drug Abuse, have shown some pretty compelling data that there are some significant brain, lung, and heart problems associated with marijuana use. As it turns out, from the National Institute of Health, we learned that the incidence of schizophrenia goes up significantly with the earlier use of marijuana in terms of your age and the chronicity, or how long you use marijuana. There's also a particular problem called acute psychotic reaction, which is kind of like, in layman's terms, kind of a toxic, crazy reaction with significant use. From a lung standpoint, it turns out there's about 50 to 70 times the carcinogenic material in marijuana smoke than there is in tobacco smoke. And we all know that most marijuana smokers inhale it deeply and hold it there longer to try to get a better effect. Well, but the problem is that it compounds, or it prolongs your exposure to marijuana smoke, or the toxins rather, and the compounds in the smoke, and thereby increasing your risk of cancer, as well as other lung problems like bronchitis and COPD. From a heart standpoint, we've also learned that you have a 5-fold increased risk of having a heart attack in the first hour of ingestion. And what that's linked to is that marijuana causes a condition called tachycardia, and that's a medical term for making your heart beat fast, and it can beat between 20 and 100 times faster than its normal resting rate, and because of that increased rate, you're at an increased risk of heart attack, and that effect lasts up to 3 hours. So yes, there are some significant medical problems with the ingestion of marijuana. And as it turns out, some people have looked into the question of whether or not dosing really is possible with this. And my response as a physician to that is it's not really possible. And I come from the position of, as a physician, we learn how to dose medications based on specific effects. And marijuana, unfortunately, does not, because there's different strains and different types, can have somewhere between 5 and 40% active ingredient in it. And so it's frankly impossible to dose the medication in brownie form, or in smoke form, or in lotion form, other than in the accepted pill form. And so I just want to tell you that there are some significant side effects with taking marijuana, so don't be fooled.